Before I talk about weird medical conditions, I will share you a traumatic experience of mine. Years ago, I was at my grandparents' store where they sell various products, but the majority of their products are fish, vegetable, and meat. The store also has a kitchen that is hidden by thin walls and a curtain covering the doorway. At the time, my grandmother was cooking while my grandfather was running the store. I forgot what I was doing, but I was outside the store and suddenly my grandmother called me. I went in the store, moved away the curtain, and I saw my grandmother holding out a plate with vegetable garbage on it. She asked me to throw away the garbage, and so I took the plate, threw the garbage in the trash can. After that, I returned to the store and head towards the curtain. I quickly moved the curtain away, and there I saw two huge melons below the chest that makes me wanna puke. Within half a second, I felt like my world has been turned upside down. My consciousness left my body, traveled multiple dimensions, and visited multiple universes. Met an alien and started a family with that alien before I got sucked into my body. And there, I realized I just saw my grandmother changing her shirt. I immediately closed the curtain and handed out the plate and reported back to her that I did what she asked me to do. I went home feeling so terrible, disgusted, and embarrassed. It mentally left a scar on me. To this day, I can properly enjoy looking at melons without remembering what happened that day. The day when I saw two melons way below the chest. I am so glad that I don't have OCD staring. If I had, the trauma and embarrassment would have been a million times worse. Now, what is OCD staring? OCD staring is one of the subtypes of OCD. Symptoms includes excessively staring at something such as objects, a person, or body parts. Having difficulty of looking away from the person or object because if they attempt to break the stare, they will feel anxiety or distress. Engaging in mental rituals or counting while staring. Feeling like they need to excessively stare to relieve anxiety or distress. Imagine if a patient that have OCD staring with the symptoms of having difficulty of breaking his stare, but that person feels like he needs to continue staring to relieve stress. And understandably, another symptom is avoiding situations that might trigger staring episodes. Patients suffering from this OCD often feel embarrassed since people are creeped out by the excessive staring. People will think that they are being stalked, or at least the patient who is excessively staring has some bad intentions, even though the patient is just staring because the patient couldn't help it. However, some patients do excessively stare imagining of pushing something or someone off a cliff or building. Moving on to the next medical condition, it is called foreign accent syndrome. It is a rare motor speech disorder that is usually caused by a stroke, and it can also be caused by head trauma, migraines, developmental problems, and even dental surgery. People with this medical condition in which the pronunciation of a patient is perceived as a foreign accent by listeners of the same language community. For example, an American patient speaks with a British accent. Other symptoms can also include distorted speech rhythm and intonations, trouble with consonants and vowels, and grammatical errors. However, a speaker with the syndrome doesn't acquire neither a specific accent nor being more fluent in a foreign language. For example, a 60-year-old British woman named Linda who suffered from a stroke in 2006. Her brother claimed that her speech resembled someone from Slovakia. Other people thought she sounded like a French Canadian or Jamaican. Even her sister-in-law asserted that Linda sounded spaghetti. Another case is one of the first reported cases was in 1941. A Norwegian woman named Astrid developed a German accent after being hit by a bomb shrapnel in an air raid by the British Royal Air Force against the Germans that occupied the city of Oslo where the woman lived. She was hit on her head by a bomb shrapnel and taken to a nearby hospital. She was in a coma for days and soon she would regain her consciousness and was found out to have paralysis on the right side of her body and also unable to speak. Over time, her paralysis receded and gradually recovered her ability to talk. Her speech, however, had changed. She sounded like a German. Unfortunately for Astrid, Germany's military occupation of Oslo had created intense antipathy towards anything German. She was falsely accused of being a German spy and was shunned by her community. Just like Astrid, other people who are suffering from the disease immediately suffers from it. But there are other patients that thought it was funny in the beginning. At the first few days or weeks, some who have this disease and their loved ones thought it was funny at first and making jokes about it. But as time goes by, they find their new accent annoying and ended up hating it because they feel like there's another person inside them who is speaking for them. Due to the medical condition being rare, some people ends up mocking the people who have the disease and calling it fake. Another weird medical condition is called Pseudobulbar Affect or PBA. PBA is a nervous system disorder that causes you to laugh, cry, and even become angry uncontrollably that can be caused by injuries or diseases that affects your brain such as ALS, brain tumor, multiple sclerosis, stroke, traumatic brain injury, and Parkinson's disease. People suffering from this disorder are often misdiagnosed as depressed or suffering from a bipolar disorder because they share similar symptoms. The difference is that in most cases with depression, you can control the symptoms and it stops once your mood changes. Also, PBA patients often react opposite of what they feel. Feeling sad even though they should be happy, or laughing at things that shouldn't be laughed at. Even though PBA patients often react the opposite of what they feel, another symptom of PBA is exaggerated reaction to your mood, like laughing excessively at jokes that only deserves a smile or chuckle. Most if not all patients who have these medical conditions I have covered are really suffering and should be taken seriously and be supportive. Also, please support my channel by subscribing and leave a like to this video.